action on the muscles now at this point. Alright, so here's what we want to do. Okay. Alright. Alright. Okay. All the chest muscles, we can remove them, so... Okay, so here's what happens to students that don't take the muscle test. That's the lab makeup test for muscles. What muscle is that?
Nice.
And then what muscle is that? So there you go. There's your makeup lab test for muscles. That's why you don't ever want to not be here when we take the test.
You serious?
You always want to be here. I'm kidding. God. It takes too much time to set the test up. That's why you don't get to do a makeup test. Because it takes too much time to set up all these cats. That's where it becomes a pain. Alright, so here we go. Now, as we come through here, through the chest cavity here, this muscle, okay, not this muscle, I'm thinking muscles, my brain's on muscles. This blood vessel right here, do y'all remember what we call him? He is a subclavian. It is the left subclavian, actually, yes. So here's, okay, did he talk to you like it's a road map? Did he kind of give you that analogy? No. Somebody's saying yes, and some are shaking their heads no.
Yes.
You change the name down the same road, okay? So it's kind of like Spencer, right here. You go on down the road, what does it become? College. And then over the highway, it becomes airport, right? And then going up this way, when you hit under 146, it becomes Maine and LaPorte, right? It's all the same road. All right, well, here's where you're going to see one of the name changes that's going to happen is we've got the subclavian. So here's my subclavian that's coming out. And then I've got my very confusing terminology, correct? All right, so let's see if I can find my very confusing terminology. I have my very confusing terminology here. My vertebral, my costocervical, and my thyrocervical, correct? Those are three coming off of here. And then I come around over here. There's my mammary, internal mammary. And then there's my subclavian coming off this way. Okay, now when I come through the rib cage, we now change names. When I come through the rib cage, God, I keep thinking muscles. Can't get muscle out of my head. The blood vessel changes names. And when we come under the armpit, kind of under that armpit area there, and through the rib cage, we now call this the axillary. So here is my ribs. Those circles are my ribs. Here is my axillary. Now my axillary, I want to look for one that is coming, either maybe pointing up or coming down. Most often I see them running down. The one running down is going to be my subscapular. So you've got a bunch of adipose in here. And we can kind of nip most of that adipose. Okay. Let's make sure. Get my artery that I want. Alright, now, here is my artery. This is a little tiny one. In this case, the latex has been blown on this one, so on some of them they're going to be bigger. On this one, he's actually been snipped and has broken off. In many cases, you'll see him come deep down here, deep down into the armpit, behind my subscapularis muscle. And that blood vessel, this blue one, I just don't want to tear up. I just want to get him out of the way. It's actually this little guy right here. He has been torn. Okay, it's this guy right here. This guy coming down, hopefully he'll be intact. But this guy coming down is the subscapular. Okay, now, this blood vessel that I have in my hand coming through, you have to know him on this side. Make sure I have him, is my subclavian. Alright. Now, this is my subclavian here that's been ripped off. Okay, so you have another subclavian vein over here as well, and that's fine, but he's been ripped right here. So this guy right here, just so as you're looking at this cat to see what's going on, this guy should be attached to this guy right there. And that's my subclavian vein that you see kind of hanging loose on this particular cat. Now, there's my subscapular, and so we want to pull him out and clean him up around from all that fat. And you're going to notice that there's a lot of armpit fat up under here. There's a lot of armpit fat because there is a grouping of nerves. The grouping of nerves that we're going to see is all of this right in here. Okay, so I'm going to pull this up. There's a whole big grouping of nerves, and it branches off into what's called a plexus. And that's actually the brachial plexus, so it's the main nerve supply going to my arm. So you're going to see all these nerves, and we don't care about the nerves, but they're going to get in your way. And so if you want to, all these nerves you can cut. Okay, and the poor kitty has just lost all feeling to his arm. Okay, but you can get those out of the way. We don't need them. And what you want is you want to follow this blood vessel now. So here's my subscapular that's pointing down, and then my name changes again. Okay, from my subscapular, past the subscapular, this now is going to go out to my arm, and we call that the brachial. So it's the brachial artery. So here, 21 is my subscapular, 22 is going to be my brachial. My brachial is going to come out all the way until I come through this little hole right here. So this is where you start peeling away the arm muscles that you worked so diligently to separate. Okay. And we follow him out here. Right here. So there's my red artery that we want to keep following. And we keep following that red artery. Okay. This is a nerve right here. We don't need that nerve. And there's my red artery. Okay, past my subscapular, this guy is my brachial. Brachial, brachial, brachial all the way down. And then this guy's just in the way right here. You can really start to take your frustrations out. Okay, now I'm going to follow him all along. I'm going to follow it down into this little hole that's going to come into play. The hole is the supracondylar foramen. That's what's number 23. You're going to feel this hard area right here. And what you want to do is you want to clean it out where you can see the blood vessel come through. You can feel the hard muscle tissue right here. And then you need to start pulling away your forearm muscles. So, bye-bye goes your palmaris longus. And we can find the guy coming out at the other end, and then we'll be able to follow it through to our other ones here. Alright, so we want to go down in here, around where that pronator teres is. There's that little wedge pronator teres, and now I can see my blood vessels coming out on the other end here. Okay, now you want to grab that pronator. Okay, and I can start to see right here. Ah, perfect. You got some more of those nerves in there. And what I have here, okay, clean it up. You don't want to clip the blood vessel. But you're going to see that the blood vessel runs through this little hole and then reappears again. So you're going to feel it right there, the hard knot, and that's the humerus. So here's my humerus bone right here. And here is my brachial artery right here. And notice when I tug on this one here, look, it pulls it through. Alright? So I've got my axillary when it comes to the rib cage, my subscapular that's going to be going down, which turns into my brachial. When I get through that hole, that supracondylar foramen, like right there, you can't poke anything through it. It's very small, but you can kind of see where the hole begins right here. That's the beginning of that hole called the supracondylar foramen. When I pull through, you can actually see and clean it up, as you can see that blood vessel come through the hole, and you can tug on it and see it comes through. When it comes through here, okay, what's going to happen is the one that comes through the hole and goes up, the larger one, is going to be my radial. We now call it the radial artery. And then we're going to see branches. They're going to branch to the lateral side of the arm, and those are going to be the ulnars. Okay, so I continue on up this way. And what I see here, okay, this will be somewhere here. Okay. It's going to be my radial coming up this way, and my little branches coming down here are my ulnars. Okay? So the cat is laying like this, right? That's the way the cat's laying, correct? The radius is here at my thumb. The ulnars are here. My ulnus bone is here at my pinky, correct? So if you imagine this being the cat's thumb, okay, laying like this, the blood vessel going up toward the medial side is my radial artery right here. And then, again, palms up like this. Here's my ulna. The blood vessels that are coming down here and branching deep down into the muscles down here, those are my ulnars. Okay, they're very small arteries. Okay? Any questions on that? Okay, that's all we'll do today. So you've got the arm, and then you have time to spend on the chest area. Okay?